Hello friends, today I am going to discuss last part of the question number 6 of Katherine Anderson mrcog 1. The content of this video is sciatic nerve, sciatica and piriformis syndrome. This is the question. We will discuss its option at the end of the video. So what is sciatic nerve? It is a major nerve of lower limb. It is a thick flat band approximately 2 cm wide, the largest nerve in the body. It derived from lumbosacral plexus. Its nerve roots is L4 to S3. Here you can see sciatic nerve arising from L4, L5, S1, S2 and S3 shown by green color. Now its anatomical course. After its formation, it leaves the pelvis and enters the gluteal region via greater sciatic foramen. Here you can see I have pointed greater sciatic foramen and sciatic nerve. You can see that sciatic nerve, after arising from its roots values, it leaves the pelvis and enters the gluteal region through greater sciatic foramen. It emerges inferior to the piriformis muscle and descends in an inferior lateral direction. Here you can see sciatic nerve passes inferior to the piriformis muscle and also moves downward and lateral position. It then enters the posterior thigh by passing deep to the long head of the biceps femoris. Here you can see after passing under the piriformis muscle, the sciatic nerve then passes under the long head of the biceps femoris to enter into the thigh. Within the posterior thigh, the nerve gives branches to muscles. When reaches apex of the popliteal fossa, it terminates by bifurcating into the tibial and common peroneal nerve. Now we will summarize what we have studied, that sciatic nerve arises from L4 to S3 is nerve roots. Then it leaves the pelvis and enters into the gluteal region passing from greater sciatic foramen. Then it passes under the piriformis muscle to enter into the thigh. And in the thigh it gives branches, and at the popliteal fossa it divided into terminal branches. Now its motor function, sciatic nerve directly innervates the muscles in the posterior compartment of the thigh. Sciatic nerve indirectly innervates muscles of leg and foot by its terminal branches, tibial nerve and common peroneal nerve. Now sensory function, sciatic nerve does not have any direct cutaneous functions. It does provide indirect sensory innervation via its terminal branches, tibial nerve and common peroneal nerve. I have discussed in detail about the tibial nerve and common peroneal nerve in my previous lecture. You can watch those for better understanding. I am also sharing the link here. Now this diagram, in which you have seen that in IM injection we divided the gluteal region in 4 quadrants, and you can see that the sciatic nerve passes from inferior quadrants. So always give IM injection in upper lateral quadrant. Now what is sciatica? It is a nerve pain occurs due to irritation, inflammation, pinching or compression of the sciatic nerve. Conditions that causes sciatica includes herniated discs, which is most common cause. Now then, degenerative disc disease, spinous stenosis, foramen stenosis, osteoarthritis, injury, tumor, pregnancy or cauda equina syndrome. Symptoms include pain, tingling, numbness in back, hips, thigh or radiate down the leg, and muscle weakness. And in very severe cases, urinary and fecal incontinence could also occur. As you know that the sciatic has nerve origin from lumbosacral region, and also bladder and bowel are supplied by sacral plexus. So when the sciatic nerve injured or inflamed, sacral plexus also get involved. So in severe cases, urinary and fecal incontinence could also occur. Complications are chronic long-term pain, drop foot due to common peroneal nerve injury, and loss of feeling in the affected legs. Now this is sciatica. Here you can see that the patient could have pain from back to hip, thighs and leg up to foot. Sciatica symptoms can affect your lower back, butt and legs. Pressure on the spinal cord or nerves is often the cause. Now the diagnosis is made by history and physical examination including walking. In this, patient gait changes and straight leg raised test and flexibility and strength check. Now this is straight leg test in which for nerve compression that causes back pain. When the straight leg test helps healthcare providers diagnose sciatica and other causes of back pain. And tests are CT scan, MRI, nerve conduction, velocity studies, electromyography and myelogram. Now treatment is self-treatments with ice, heat, over-the-counter medicine like NSAIDs and stretching and activity, conservative treatment which is done by doctors. They prescribe medicine like painkillers, muscle relaxant, antidepressants or anti-seizure medicines. Physical therapy, stretching exercises, low impact activities like walking, swimming or water aerobics. And spinal injection of corticosteroids. Then alternative therapies are also very popular like spinal adjustment, yoga, acupuncture, massage and biofeedback. The biofeedback, it is basically mind-body therapy that can improve physical and mental health. In this, basically the practitioners use painless sensor to measure certain body function. And surgical treatment is discectomy and laminectomy. Piriformis syndrome, it refers to compression of the sciatic nerve by the piriformis muscle, also known as deep gluteal syndrome. Clinical features are radicular pain. Radicular pain is a type of pain that radiates from your back and hip into your legs through the spine. Numbness, muscle weakness, and hip tenderness. The pain can occasionally be exacerbated by internal rotation of the lower limb at the hip. Now here you can see sciatic nerve passes under the piriformis muscle and here it can be compressed by piriformis muscle. So diagnosis is by history and examination. X-ray, MRI images is usually unremarkable but can exclude other pathologies such as spinal compression of the spinal nerve. Treatment is non-operative analgesia, physiotherapy, corticosteroid injections and operative piriformis muscle release. Now the question was with regard to innervation of the lower limb. I have discussed first 4 options in my previous videos. Option 5 is the sciatic nerve is derived from L4 to S3. It's true. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates. Thanks.